Your eyes are more than just a part of your body. They're how you see the world, how you watch your kids grow up, how you take in a beautiful sunset, or read a good book. They're small, but they're incredibly important. And because they're so important, it's frightening when something goes wrong. Redness, itching, pain. These are signals. Your body is telling you something isn't right. The key is to listen and know what to do next. This isn't about becoming a doctor overnight. It's about a clear, simple plan. No complicated medical jargon, just straight talk. Think of this as a first aid guide for your eyes. Be prepared, stay calm, and take control. Let's start with the first line of defense, your eyelids. They're the gatekeepers protecting your eyes from dust, debris, and injury. But sometimes the gatekeepers themselves run into trouble. Red, swollen, and sore. One common issue is blepharitis, eyelid inflammation with burning, a gritty sensation, and crust along the lash line. First step is hygiene. Warm compresses for 10 to 15 minutes, a few times a day, to loosen crusts and soothe. A doctor may prescribe antibiotic drops or ointment. Follow directions precisely and avoid touching your eyes with unwashed hands. A chalazion is a firm, usually painless lump from a blocked oil gland, not typically an infection. Use warm compresses several times a day and gently massage to help it drain. See an eye doctor if it's stubborn. A stye is a tender red bump at the lid edge, an infection in an eyelash follicle. Warm compresses help it come to a head and drain on its own. Never try to pop a stye. A doctor might use antibiotics, and if it won't drain, they can treat it quickly and safely. The word pink eye gets thrown around a lot. Pink eye is the common name for conjunctivitis, inflammation of the conjunctiva. There are different types, and the treatment for one won't work for another, like using the wrong key for a lock. Bacterial conjunctivitis shows thick, goopy yellow or green discharge in lids that can feel glued shut. See a doctor for antibiotic drops or ointment and complete the full course. It's contagious. Wash hands and don't share towels or pillows. Viral conjunctivitis is linked with a cold, red, watery, gritty, but not thick pus. Extremely contagious by touch. Antibiotics don't work on viruses. Use artificial tears, cool compresses, and practice top-tier hygiene. Stay home to avoid spread. Allergic conjunctivitis causes intense itch in both eyes with watering and redness, often with sneezing or a runny nose. Not contagious. Avoid triggers if you can. Over-the-counter antihistamine eye drops help with itching. Cool compresses bring relief. If allergies are severe, an oral antihistamine can calm your body's overactive response. Know the type, choose the right approach, and protect the people around you. Now, the situations that are more than an annoyance, problems that need immediate attention. An eye burn, chemical splash, or a blast of heat can cause severe permanent damage. If a chemical gets in your eye, flush immediately with clean, cool water or sterile saline for at least 15 minutes. Hold the eyelid open so water reaches everywhere. After flushing, go to the emergency room, fast. Dacryocystitis, an infected tear sac from a blocked duct, causes pain, redness, swelling near the nose, and sometimes pus. This is not DIY. See a doctor for strong antibiotics, often drops and oral pills. Recurrent cases may need surgery. Viruses like Ophthalmic Herpes or Zoster can scar the cornea and threaten vision. Intense pain, redness, and sometimes blisters. If you suspect this, see an eye doctor right away. Antivirals, ointment, or pills work best when started early. A foreign object lodged in the eye is an emergency. Do not remove it yourself. Shield the eye and head to the ER. Don't be a hero. Let the experts handle it. Sometimes it's not an infection or an injury. It's a constant nagging discomfort. Dry eye, common and miserable. Burning, stinging, that gritty sand in the eye feeling, redness, and paradoxically, watering. Your body overcompensates with low-quality watery tears that don't lubricate well. Causes include age, health conditions, medications, and our screen-heavy lifestyle. We blink less at screens, and dry, windy, or air-conditioned air speeds up tear evaporation. Start with artificial tears. Over-the-counter drops to supplement natural moisture, used as often as needed. For more severe dryness, Thicker gel-based drops at night can help. Add humidity to your air and optimize your workspace. Follow the 20-20-20 rule. Every 20 minutes, look 20 feet away for 20 seconds. Allergies often add intense itch. Antihistamine eye drops can provide fast relief. When your eyes are red and hurting, it's easy to make mistakes. So let's lay out the rules, do's and don'ts. Do wash your hands with soap and water before and after touching your eyes or applying medication. Do use warm compresses for styes and blocked glands. Gentle heat helps. Do use only the drops or ointments prescribed for your specific problem. Do use a fresh, clean tissue or cotton each time you wipe to prevent recontamination. Do not rub your eyes. It spreads germs, can infect the other eye, or scratch your cornea. Do not share eye drops, makeup, towels, or pillowcases. These pass infections. Do not use someone else's leftover prescription or old drops. Wrong medicine or contamination risks. Do not wear contacts when your eye is red, irritated, or has discharge. Use glasses until fully resolved and cleared by your doctor. Most importantly, don't ignore severe pain, sudden vision loss, or extreme light sensitivity. Seek urgent care. We've covered styes, pink eye, dry eyes, and emergencies like chemical burns. Some you can manage at home. The most important thing is knowing when to stop and get professional help. Seek urgent care for sudden loss of vision, very blurry or dim vision, severe deep eye pain, flashes of light, a shower of floaters, any chemical splash, or an object stuck in the eye. Don't wait to see if it gets better. Call promptly if a red, itchy eye isn't improving in a couple days. There's thick pus-like discharge or extreme light sensitivity. Redness and pain with headache or nausea also warrant a call. Your eye doctor has the tools and expertise to see what's really going on. See the symptom. Take a calm first step. Warm compress or rinse. If it's severe or not improving, follow up. Protecting your sight is vital. Being informed is your best defense. Stay calm, act smart, and lean on medical experts when needed. Your eyes, your windows to the world, are worth it.